Good afternoon, everyone, and welcome to this month's Simon Says Expert Series. My name is MacKenzie White, and I am proud to serve as the Executive Director of In Lung Cancer Now. In Lung Cancer Now is an initiative of the IU Simon Comprehensive Cancer Center that was founded in 2020 with the vision to end the suffering and death from lung cancer here in Indiana. We are proud to be 100% supported through philanthropy. The support of our donors and our sponsors has allowed us to think big, move fast, and reach far into communities across the state. At our core, we exist to end the suffering and death from lung cancer here in Indiana, and we approach that through a set of values centered on innovation, collaboration, and urgency, because the reality is this work demands urgency. This month, we are celebrating 1 year of Indiana's first and only mobile lung screening program. And so we are excited to talk about that, what we've achieved through this program, and what's coming next for In Lung Cancer Now. I'm honored to be joined today by Dr. Nasser Hanna, the Tom and Julie Wood Family Foundation Professor of Lung Cancer Clinical Research and a Professor of Medicine at IU School of Medicine. He also serves as the Chief of Cancer Screenings for IU Health and is the founder and chair of In Lung Cancer Now. He is in clinic 2 days per week to see patients with both lung and testicular cancers. Welcome, Dr. Hanna, and thank you for joining me today.
Thanks, MacKenzie. I'm looking forward to the conversation. I always love talking about the vision and mission of End Lung Cancer Now.
Well, thank you, and I'm excited to have this conversation. Lung cancer remains the #1 cause of cancer death in the United States and, of course, in Indiana. And yet, for far too long, it's not received the same level of awareness, research funding, or advocacy that really matches its devastating impact. So you've spent your career on the front lines caring for patients impacted by this disease. So what made you feel that something fundamentally different needed to happen to truly change outcomes? And where did this idea for In Lung Cancer Now come from?
Yeah, thanks, MacKenzie. You mentioned that lung cancer is the #1 cause of cancer-related death. And, we've said that for many years and actually decades. But the truth is while that's still true, the numbers are coming down at a pretty rapid rate. And so I think a core message about lung cancer is that mortality rates are markedly declining. And that's for a variety of reasons. And part of that is the advocacy work that has been done by a number of groups across the country. So there is a lot of good news. My interest in this came from the experience taking care of people and their families and their loved ones and their caregivers. When I joined the faculty 25 years ago, things were really grim in the area of lung cancer. There was a lot of guilt, stigma, shame. There was a lot of hopelessness. We had very high tobacco rates. We had no lung screening. We had really very few effective therapeutics outside of surgery and radiation therapy. There was very little advocacy. There was very little bit of investment in research. It was really a difficult time, and it was through that experience of taking care of people and helping them through their cancer journey that really sparked a passion in me to do more than just treat them when they were diagnosed with lung cancer. And so that really is the deep reason for my advocacy and the work that I care very passionately about. The lung cancer community for too long has been stamped with guilt, stigma, and shame, and it's really undeserved. No one deserves lung cancer, period. And there are many reasons why people get lung cancer, and it's oftentimes the result of multiple risk factors. And so I think that's an important message for us to really underscore. Uh, at the end of the day, we cannot treat our way out of lung cancer. We have to prevent it and we have to detect it early. And that's a core mission of the work that we do. So that's where a public health approach becomes essential. MacKenzie, can you talk about how community engagement and prevention fit into that strategy.
Yeah, of course. I want to address the importance of community engagement first. In Lung Cancer Now, we are a small staff team, and so we're really built on the foundation of community. And we've intentionally built a strategy that looks beyond the walls of the clinic, and the research labs and really reaches into the communities where people live and work, where they go to church, where they celebrate birthdays and holidays with their families, where they hang out with their friends, where they go to school, where they feel safe. And so executing this kind of strategy, to advance the prevention and the early detection, it really requires strong partnerships with community organizations, with local healthcare providers, with local leaders, and community advocates. And I think that's what makes us unique and how we pull all of this together. We really serve as the convener and connector of our health system, of our doctors and researchers, of patients and families, of community partners. They serve on our advisory board. They're involved with planning our events. They show up to volunteer at local community health fairs. And so our community that we've built internally that then reaches out across the state really is essential to those components that you mentioned. They're raising awareness and enhancing the education about lung cancer. Many people don't know that lung cancer is the leading cause of cancer-related death, but yet it receives the least amount of research funding on a national level. Our community helps us to actively reduce that stigma, shifting away the narrative away from blame and shame and toward compassion and action. It's not just a disease that impacts people who have a smoking history. And then expanding access to and awareness of screening. We know that early detection is one of the most powerful tools that we have to save lives. But in Indiana, only 19% of people who are eligible for screening participate in a screening program. And I think what's important here is to compare that to the number of people who get colonoscopies and mammograms. That's 65 to 75% of people who are eligible getting their colon and breast cancer screening. So we have a lot of work to do to increase that lung cancer screening rate. And then focusing on prevention, trying to stop lung cancer before it starts, educating people about all modifiable risk factors and how we can reduce them, and then how to get to early detection if you are at high risk. What I know from experience being out in the community, most people, when we say the word prevention, think just about smoking. But we say something important here at In Lung Cancer Now, that anyone with lungs can get lung cancer. So Dr. Hanna, can you explain what we mean by that? What are some of the other risk factors? And then how does that translate over into screening and early detection?
Yeah, thank you, Mackenzie. And, just spending some time in my clinic, you will quickly realize anyone with lungs can get lung cancer. I have somebody who's 22 years old that I'm taking care of. My youngest patient was 19. They come from all walks of life, male and female, older and younger, suburban, urban, rural, those that smoked, those that didn't smoke, those who had other risk factors, those in whom we can't explain why they have lung cancer. So we take about 20,000 breaths a day, each one of us. 20,000 times every day we take a breath. So, what we inhale from the atmosphere, from the air, matters. It gets absorbed. You get it along the lining of the airways. It gets absorbed into the air sacs. It eventually gets absorbed into the bloodstream. So, breathing clean air is so important, not only to prevent cancers, including lung cancer, but also for lung health and your general health. Yes, it is true that cigarette smoking is a major risk factor for lung cancer. It's estimated that you acquire a unique mutation in your DNA, permanent mutation in the DNA of those cells lining your lung, about every 3 or so cigarettes that you smoke. So if you smoke a pack a day, that means that day you acquired about 6 new mutations in the DNA, and these mutations stack up. So So things that cause mutations in the DNA can cause lung cancer. So what else causes mutations? Inhaling somebody else's smoke has the same carcinogens in that smoke, especially if it's at home or in the workplace when it's over a prolonged period of time. Radon is a major cause of lung cancer. About 1/3 of homes in Indiana have very high levels of radon that the EPA considers to be dangerously high. About 1/3. Recently, one of our advocates did a radon test in her home, and she found that her radon level was about 12. That is equivalent to smoking about a pack and a half cigarettes a day. One of our other advocates actually had a radon level of 30. Anything above 4 is considered very high. Radon is radioactive material. It's in the soil. 1/3 of homes in Indiana have dangerously high radon levels. Air pollution, air quality, working in certain occupations, being an iron worker, being a stone cutter, construction work, home builders, people who have chronically inhaling substances into their lungs, which can be carcinogenic. So, the more risk factors you have, the more likely you are to get lung cancer. It's like heart disease. If you have high blood pressure, it's a risk factor. But if you have high blood pressure and diabetes and high cholesterol and you smoke and you have a family history, your risk factors keep stacking. So, not everybody is equal. Some people have multiple risk factors. The more risk factors, the worse that you are. But honestly, even with the greatest prevention efforts, if we just wiped away all the causes of lung cancer, we are still going to be left with millions of people who will be diagnosed with lung cancer in the upcoming years. So we can't just simply focus on prevention. Screening remains a powerful tool to save lives. And low dose lung screening is an incredible tool to do so. It detects cancer before you develop any symptoms. See, if you are at risk for lung cancer and you get lung cancer and you are part of a lung screening program, most of the time your lung cancer will be found in stage 1. Stage 1 lung cancer is just as curable as other stage 1 cancer, stage 1 breast cancer, stage 1 colon cancer. The problem is if you're diagnosed with lung cancer and it's not done on lung screening, it will probably be stage 4. So it's so critically important. You mentioned Indiana has a 19% lung screening rate compared to 75% for breast cancer and colon screening. Believe it or not, Indiana is like one of the top 15 states, and we're at 19%. Now, the good news is because of our efforts, IU Health is above 30%, and my goal is by 2028, we will be at 75%. And we can do this. The mobile lung program is a critical part to this. So know your risks, know if you're eligible. So what is the eligibility criteria for lung screening? 50 to 77, that you have a smoking history, even though many people with lung cancer have never smoked, but right now that is the criteria. It's a 20-pack year or more history, which means the number of years you smoke times the average number of packs you smoke per day. So 1 pack per day for 20 years is a 20-pack year smoking history. So that's essentially the criteria, is having had that smoking history and being of that age. But unfortunately, many people get lung cancer who don't meet that eligibility criteria. The good news is we have a clinical trial that will be opening very soon that will offer lung screening for those high-risk individuals who don't currently meet our lung screening criteria. So if you didn't have that 20-pack year smoking history, but you have a first-degree relative with lung cancer, and maybe you're an iron worker between the ages of 50 and 77, That would be an example of somebody who would be eligible for lung screening. But MacKenzie, lung screening only works if you actually have access to it. And that's part of what led to the launch of Indiana's first and only mobile lung screening program. So, can you tell us how the mobile program came about?
Yes. So we launched a screening task force, which I think the last time we were on Simon Says, we talked a little bit about this. But we realized as a group, we know that there are many disparities related to lung cancer outcomes. One of those in Indiana being where our Hoosiers live. Rural counties tend to have higher incidence rates, so the number of lung cancer cases, higher mortality rates, the number of lung deaths due to lung cancer, and highest rates of late stage diagnosis. So highest number of those getting diagnosed at stage 3 and 4. We also know and found that in these areas, there is less access to screening facilities, less screening facilities in general. Rural Hoosiers tend to have some transportation needs and barriers, time constraints to travel to a nearby screening location. And just again, that overall lack of awareness that screening is available and likely recommended for them. So instead of expecting people to come to us and seek out lung screening, we decided to go to them. So we received a very generous gift from the Tom and Julie Wood Family Foundation. It was a $4.5 million gift with a match from the IU Health Foundation to develop and launch this program. We did 2 years of planning, I think, to get this moving, but we officially were able to launch in March of 2025. So we've been on the road for just now at our first year, and we've seen tremendous progress. I will say going to other conferences, sharing about our mobile program, learning about other mobile programs around the country, we really are one of the most successful programs in our first year. We've reached 39 counties across the state. We've hosted more than 100 screening events, and we've screened nearly 750 Hoosiers. As of today, that number has already increased. We've already gone to more than 40 counties, but at that year mark, that's kind of where we landed. We've found some lung cancer, but we've also found some breast cancer. We've found other incidental life-saving findings that wouldn't have been found if people weren't getting screened. The Lodo CT, it scans a large area, so we talked a lot about this in our planning. It finds a lot of stuff, so our team is built strategic and intentional about making sure that we can connect patients to anything that they may need and being able to care for them as a whole. And so I think the importance is not just on the numbers. We talk about this a lot in Lung Cancer Now. It's not just how many people were there, but really how we work together, how our team works, and really what is the long-term impact. We lead as a group in Lung Cancer Now the community outreach and engagement efforts in collaboration with our cancer center and the statewide IU Health team. But really essential to this mobile program success has been the partnerships with trusted community organizations, where we can bring the mobile unit and park in familiar, trusted, accessible settings. We've gone to churches, fire stations, food pantries, health departments, big employers, libraries, and being able to be in these places that people are familiar with has really, I think, engaged them in a different way and made them curious about what this mobile screening truck is. I also think on top of the community partnerships and the collaborations, our team has been very strategic and intentional about making this as easy as possible for people to get screened. We're trying to reduce barriers, and so let's reduce all of the barriers that we can. There is a website, iuhealth.org/lung screening. There's a box at the top of that website that says view upcoming mobile screening events. And so if you go there, you can see all of the upcoming mobile events, the dates, the locations, where it will be specifically, which county. And if you think you are eligible or you have a family member that might be eligible, we have set it up in a way that you can refer yourself. You can submit contact information for that date and location, and someone from our mobile team will follow up. They will confirm your eligibility, they will check your insurance, they will do shared decision making, and they will get you officially scheduled for that screening appointment. So reducing the barriers of having to go through your primary care or getting a referral from a physician, we have made it simple where you can refer yourself as well. We also have some of this information on our In Lung Cancer Now website under the Screening Saves Lives. But once you are followed up with and connected and scheduled, our mobile team will give you the date and time of your appointment. On that day, you show up to the truck, you walk in, you check in, then you go to the back, you get scanned. The entire process takes less than 10 minutes. Then you can expect to get your results within 7 days. Most of the time, it's sooner than that. Someone will follow up with you directly, and they will also follow up with your primary care provider and make sure that communication is also shared. So our mobile team is amazing at making this as easy and simple and quick as possible for patients from start to finish. If there are any findings, our team, our navigator will help connect you with those resources and really get you connected to the team that you need. And our goal is to get you cared for close to home. So if you are not close to Indianapolis or not close to an IU Health facility, that's okay. Our team is prepared to get you somewhere that's close and convenient should you need follow-up care. And so I think from a clinical standpoint, Dr. Hanna, when thinking about that follow-up care, thinking about what might be needed after someone gets screened, why is finding lung cancer earlier such a game changer? I think you talked on this a little bit, but can you just kind of reiterate that importance?
Yeah, well, it's definitely a game changer because it saves lives. And not only does it save a person's life, but that impacts their loved ones. It impacts their families. It impacts all the people that care about them as well, because lung screening detects lung cancer usually in its earliest stage. And again, the reason why lung cancer has caused so much suffering over the last century is not because it's a worse cancer. It's because it's usually detected late. And in most people, when it's detected late, it's not curable. So early stage lung cancer is highly curable. I want to say that again. We cure the vast majority of people with early stage lung cancer. I want to say it again. Lung screening detects most cancer in its early stage. So it's really important for us to scale and amplify this program. And I am so grateful to the Wood family. This public health initiative is saving lives, it's saving Hoosier lives. It's saving a lot of rural Hoosier lives. It's a public health initiative. I couldn't be more proud of it. I think it's one of our crown jewels. And this is really what happens when philanthropy is merged with a worthy cause, and then you have a team that's dedicated, a team that thinks about this program, that strategizes, that cares about that truck, and that cares about the community. And truly, this team cares. And I can tell you, each and every person that works on that team, this matters deeply to them. They know how important it is. So, MacKenzie, the first year has taught us a lot about what it takes to expand screening across access, expanding access across Indiana. This is hard work. It is super hard work. So, what are the biggest lessons we've learned bringing screening directly into these communities?
Yes, it is hard work and it's complicated and complex, but our team truly is dedicated to figuring this out and doing what we need to do to make it a success. We've learned a lot in this first year. And I think one of the most important things is simply driving a truck across Indiana and parking it is not enough. Access is not enough. We need to make sure that we have trust and build up knowledge and support those being screened. So first, trust drives participation. This is what we've learned. We've gone to 39 counties. Some have been more successful than others. But when we offer screening in partnership with those local trusted organizations, and there is an engagement from the groups hosting us and buy-in. And when they are sharing on their social medias or sharing with local media channels, the newspapers, the news stations, that's where we've been most successful. When people in their community hear from others in their community that we are coming and that they should participate in this screening. Second, education must come first. One of the biggest gaps still is knowledge and awareness. When I first started in this role, I had no idea what lung cancer screening was. I didn't know what eligibility criteria was. And so In Lung Cancer Now on a whole aims to go into communities even before the mobile unit is there to educate people about what lung cancer screening is, what is the eligibility criteria, how they can be screened. We've met so many people throughout so many events, similarly have never heard of lung cancer screening, don't know what it is. And so that education is very important. And then finally, I would say humanizing all of this, sharing stories, patients being brave to share their story, that really translates and resonates in those local communities, and I think also inspires action of others. We've seen this firsthand. We actually screened a gentleman in Union County at a local clinic. He shared with us that he was hesitant at first to be screened. He was feeling fine. No one had ever told him about lung screening. His doctor had never recommended it. He ultimately decided to get scanned on the truck, and we actually found early stage lung cancer. And so he was able to have surgery. He is doing well. And so now he is sharing his story and inspiring others to take action. And then I think another patient story that resonates with me is we have done a lot of work with local fire stations and firefighters. We know that firefighters are at higher risk of developing lung cancer due to some of their occupational exposures. And so this particular patient was screened through our firefighter program. Again, he was feeling great, no symptoms. We did not detect lung cancer in this patient, but we did detect an aortic aneurysm that required surgery fairly quickly. Again, if this truck hadn't been there at the right time, at the right place, and interacted with this person, they might not have ever known until it was too late. So I think reiterating the importance and sharing the stories of those patients, again, humanizing this disease, reducing the stigma around lung cancer screening, that's been one of the biggest lessons for us as well. And so moving into this second year, trying to engage more with our community partners, reaching out to local media, that is something that we learned when a local newspaper runs a story that we're coming, there is high engagement. And so our goal is to let's double the number of scans that we do in the second year. Let's reach 1,500. Let's go to 30 more counties. Ultimately, our goal is to reach all 92 counties across the state. And it's a dream, but we would love to be able to screen up to 3,000 Hoosiers a year. And so we will continue working towards that goal. And when we think about these big dreams, these big aspirations, these big goals, we know that creating that lasting change and how do we keep this work moving forward outside of ourselves, we need to invest in people that will carry this work forward, this next generation of lung cancer advocates. And I think that's partly what inspired this McHenry Sherman Trimble in Lung Cancer Now Academy that we are building now. So Dr. Hanna, can you talk a little bit about that and how that came to be?
Oh, I would love to talk about that. And just to underscore something that you said, MacKenzie, when we reach our goals for lung screening on the mobile program will be the busiest screening site in the state, in the history of this state. And we hope to accomplish that within the next year. And I'm so proud of the work and the effort that has gone into this. So last year at End Lung Cancer Now, we decided to try to build awareness about lung cancer, the risk factors, the modifiable risk factors throughout the state. And so we are developing an academy. It is supported by several generous donors, the McHenry, Sherman, and Trimble family. So it's called the McHenry Sherman Trimble in Lung Cancer Now Academy. And this is an academy that is going to invest in the future. It's investing in students, It's helping to develop students into our next public service leaders when it comes to public health, particularly when it comes to lung cancer. And so the Academy is going to train a select group of students on campuses throughout the state of Indiana. This is not simply Indiana University, this is any campus within the state of Indiana. We're going to give them the leadership skills that they need, the organizational skills, the communication skills, and empower them to become leaders on their campuses and in their communities to educate and empower individuals about risk factors for lung cancer and how they can be part of the future at realizing our vision, which is to end the suffering and death of lung cancer in the state of Indiana. I'm very excited about this. I think it speaks to the service and servant nature of the ecosystem that End Lung Cancer Now works in. We like to say that anyone can be great because anyone can serve. And so we want to teach our students and our future leaders about this incredible gift of service to work on something that is larger and bigger than themselves to help one another. And that academy is in development right now. We do have an event coming up on April 15th, which is going to highlight many important aspects of that academy. It will be at the campus center on IU Indy's campus. It's on Wednesday, April 15th from 12 until 2 o'clock. So I hope as many of those who are listening can join us, and we will give you a nice tour of what that academy looks like. So I'm super excited about that, and you know, none of this work happens in isolation. Um, can you talk to us, MacKenzie, about the broader community that is helping really move all of the great work of End Lung Cancer Now forward?
Yeah, of course. And I think we've touched on this, I think, throughout our entire conversation and just the importance of community and partnerships. The progress we've made so far is only possible because that incredible community of people, again, our donors, our sponsors, our the patients and their families who share their stories, who advocate for change, our volunteers that show up at events, our partners who open their doors and help us build trust in their communities. And we say a lot too that real progress happens when the science, the community, and the advocacy piece all come together. And I feel like that's what we're continuing to build. I know we have a lot of good questions in the chat, so I want to make sure that we answer those before we close. And then maybe at the end, Dr. Hanna, we can just come back to, after we answer some of these questions, come back to what does ELCN look like? What is your vision? What does success look like after all of this? So I'll ask you a couple of questions that have come through. Let's start with, do we see the smoking history requirement being eased for eligibility? If a doctor has concerns and wants a patient to be screened due to other risk factors, can he or she make that happen?
So right now, lung screening is covered at no cost sharing if you meet the current eligibility. So that's for Medicare, Medicaid, the Affordable Care, private insurance, et cetera. And you do have to meet that criteria. We do have a protocol that will be activated very shortly for the mobile program that will look at other high risk individuals. And those would be people who maybe have some smoking history but don't meet the threshold of being eligible, or they have other major risk factors such as their occupational risk, their radon exposure, family history, chronic lung disease, and so forth. I think the easiest way to find out if you're eligible is to call, and our navigators will screen, first of all, whether you're eligible for lung screening based upon the current screening criteria. And if you are not, do you meet potentially the eligibility criteria of the protocol that we are initiating?
Thank you. If it translates over into it being a diagnostic scan, but it's not covered by insurance. Can patients pay out of pocket? Is this cost prohibitive based on your experience? What would you say to that question?
Well, some people can get a scan, and there are some sites that you can pay like $49 out of pocket. But frankly, if you're eligible for lung screening, you shouldn't pay anything. It's covered by insurance, Medicare, Medicaid, and so forth. And if you are at high risk but don't meet these eligibility criteria, I think you can get lung screening on our mobile program. We would just confirm that you meet some of those other high risk criteria. And if you don't meet any of the high risk criteria, you should have caution to do lung screening because we do find things, and sometimes those things can lead us down a rabbit hole. So, this is not something that should be done just for everyone, particularly those that are at low risk.
Thank you, Dr. Hanna. I'm going to go back to another risk factor, radon. And I can probably answer this, but the question was, are there affordable radon detectors that consumers can purchase to monitor their risk? And is help available through local fire department communities for this? The American Lung Association has radon detectors that you can, or radon tests that you can order off of their website. I think they're less than $15, maybe around $13. And you would test your home, you send it in, they send you the results. If your levels come back high, you would need to do some mitigation. Our Department of Health on their website has some information about radon mitigation, radon testing. So I would say those two resources are probably the best. The ALA to order that radon test kit, that's again, less than $15. And then our State Department of Health's website has some great information about radon.
Yeah, and I'd like to add to that if and Lung Cancer Now is out in the community, we do a lot of community events. And at those community events, we do give out free radon detectors. So if you come to one of our community events and you see End Lung Cancer Now, you probably can get a free radon detection kit right there at the event.
Yeah. Let's see. Is your program in Indiana being developed for other states' consideration and use?
So the answer to that is yes. And we are approached by other programs to ask us about our lessons learned, just as we approached other programs when we were starting out. We approached the program in Charlotte, North Carolina, as well as that in one in Tennessee and in West Virginia. And there were a few other programs that we consulted. There are unique aspects to each state that you will just have to learn lessons based upon your state and your population and the dynamics that take place there. There is so much learning that happens within the first year of developing these programs, but it's imperative for us to share knowledge. And even in the next week or two, a new program in the state of Missouri is coming to shadow us and ask for our advice on developing a mobile program. This is really hard work, but we have to do this together.
Yeah.
And, anything that we can do to help other states, we will absolutely do, just as those programs in other states helped us.
Yeah. Thank you. The last question in the chat is asking about what counties in Indiana have had the most people screened, what counties haven't had screenings that you wish could host a screening day. How can I help support this mission? So I think this translates well into sharing that we have a brand new website that is now live. On this website, we have our 2025 impact report that shows a beautiful map of the state that shows where we have been highlighted in green. So any counties that aren't green, we would love to go there. And ways to get involved. Our new website outlines a lot of different things that you could do if you're specifically interested in helping support this mobile program. We have a form that you can fill out, submit your contact information. We love to get volunteers, recruit community advocates. We have tons of events throughout the year that we would love for people to participate in. But our website really outlines all of that, makes it easy to kind of find where you feel comfortable. We say that a lot when someone asks what they can do. We kind of ask them, well, what do you want to do? Because we think advocacy is very personal. And so we want to make sure we're engaging you in the way that speaks to you the most, because we know that together, again, I think a theme of this whole conversation has been teamwork, community, network. We're all in this together. And I think that we all working together can really end lung cancer now here in Indiana. So, Dr. Hanna, as we wrap up, what does the ultimate success of in lung cancer now look like to you? Where do you see this going? What is the dream?
Well, thanks, MacKenzie. And first of all, I really enjoyed this conversation. I feel very fortunate that you are the executive director of End Lung Cancer Now. I think you lead an incredible team of people with servant hearts. They work together as a team. It's all about the vision and the mission and the core values. And that's embodied in your leadership style. And whenever I'm asked, why is End Lung Cancer Now so successful, I say it's because we have great leadership in our executive director who sets the tone for the team, and it's incredible teamwork. So, to answer your question, when I began to think about this organization, it's very important to name it something that is very purposeful. Just like all of our names, when you're a new parent, you're going to name your child, that name is incredibly meaningful. So the name of this organization came with a lot of care and attention. It was not only important to me to end lung cancer, and that's because of the tremendous amount of suffering, the toll that it takes on people and on their communities and their families and their loved ones. But the last word in the name of the organization is very intentional, and that is the word now. We want to end lung cancer now. That remains our vision. We want to end the suffering and the death of from lung cancer in the state of Indiana. So we always keep our eye on that dream. We work purposely and intentionally and strategically with that vision in mind. We've developed the mission pillars to achieve that vision. The solutions are not complicated, but they're difficult to implement. We want to reduce all modifiable risk factors for lung cancer. We want to detect lung cancer in its earliest possible stage. We want to promote education about research, and we want to support people with lung cancer. We want to be their voice. We want to advocate for them. We want to amplify the message. And we want to do that for their loved ones and their caregivers and their communities. So we will always stay focused on that in all the work we do. And that's what keeps us energized and excited. So, for those that are listening, thank you for tuning in. I can truly tell you that MacKenzie and I had a great, enjoyable 45 minutes with you today. We work purposely, we work joyfully, and we absolutely love this work. And if you want to be a part of this ecosystem, if you want to give your talents and your time, we are absolutely ready to open our doors for anybody who wants to help support this cause.
Thank you.
Thank you.